So it's funny. Yeah. I mean, since I've been testing these chains on patients, I get the same kind of reaction that I do with some of the more primary provocative testing that I do, which is, a simple kind of one of the tests, the chain test that we do is a simple rolling test, turning test side to side. And the patient is at this point, by the time I'm testing this, the patient's painful symptoms are generally, they're feeling pretty good at this point. So they're feeling good about themselves. They're feeling strong and they're feeling good. And they're passing usually some of the tests already. And I'm telling them, look, see how much better you're doing. You weren't able to do this before. This was weak. That was weak. This was a problem. It's all better. And then, I check their ability to turn to one side and they just fall right over. They have no ability. And they start laughing. It's funny to them. They said, how can I not push again? I can't, you're just pushing me right over. And this is just part of this process that we have to go through assessment. And they'll laugh even harder because, I go to the other side and they're perfectly fine. They can generate force. They can stop the turn. They can control things, go right back to the problem side, push them right over. And they just laugh. It's very funny to them. I reinforce this, that it isn't necessarily, that's an example of, it's not a strength issue. It is a sensory issue. It's a coordination issue that if you just were capable of feeling and were, feeling the support and aware of the muscle coordination, it would be there in an instant. You would feel, you would be able to generate the force. And in fact, that's what eventually happens once we facilitate the chain and treat them. And so then they're just as surprised that they can do it then at that point.
Exactly. Without a long strengthening program.
Right.
And this brings us to the point that the chain, in order to be efficient, you must first establish a fixed point. The inability to establish the fixed point absolutely renders the chain ineffective. So it is rarely, can you establish a fixed point? And if not so, how can we help you to feel the establishment of that fixed point? Once you can establish a fixed point, you can then anchor the chain and you can use it efficiently. Without it, it doesn't work. So I'm fascinated always by this, that the fixed point resides in the central nervous system perception. It is absolutely something that has to be real to the brain, otherwise it doesn't exist. And
that's almost like your black box analogy.
Yes. Yes. Or the trigger point analogy, that the trigger point resides in the brain.
Right. Yeah. The trigger point isn't actually in the muscle. It's the sensation.
And treatment requires a central nervous system involvement if you are to rarely effectively dissipate it. And yet the effect is, the resultant effect is a physical, painful perception in the muscle. And the same thing, without the ability to establish the fixed point within the sensation of the brain, you cannot materialize it in the physical world, and therefore you are going to be forced to find alternative substitutes for force generation. And because they're inefficient, they will cost you more. You will have to use more force to stabilize and to move external load than you would if you could actually establish the trigger point.
I think this can be...
establish the fixed point,
Yeah. Well, I think this is an example, or we've talked about this and demonstrated it in recent courses, you and I, where we didn't come up with this phenomenon, but we talked about the idea of when we demonstrate like the transition from supine to rolling on the side and uprighting into oblique sit and high oblique sit, that should not take a lot of muscular effort in order to do that. And at least I use the phrase, if you feel like you have to muscle yourself up through your shoulder, through your arm and press, you're doing it wrong. And I mean, number one, I would say if you watched an infant roll and upright, they're not muscling themselves up with their chest and their shoulder. They are just essentially utilizing the support points well. The abdominal, the slings are coordinated at that point and lift you off the ground very easily. And in fact, when you do it, when we as practitioners or our patients do it, when I do it, I immediately feel the difference of coordination and uprighting with relative ease or effortless versus muscling myself up. And it's because I'm not either transferring weight to the support points. I'm not getting to the support points. So my muscles don't essentially know what to do at that point. If they can't feel adequate support, the muscles don't know what to do. And now you are still going to move. So then the muscles you'll really pull and contract and you'll overdo it. It becomes ineffective, basically.
Yeah.
But I think that's kind of what you're talking about. And we've talked about in the past how you've kind of theorized that this is how muscles strain or muscles cramp or how trigger points are created in the first place. That you might be running in one direction, plant your foot, attempt to turn into another direction, and your hamstring strains or your adductor strains and pulls. And you have theorized that, well, you've done it 1,000 times. Yes, there might be an aspect of overuse or fatigue or something like that. But even then, the overuse and fatigue would be explained by when you planted your foot to change direction, you were not supporting through your foot adequately. And when you lose a support point, the muscle coordination that runs all the way down through your foot doesn't know what to do anymore. So the muscle contraction becomes very ineffective and uncoordinated. So if you constantly are loading your foot poorly and changing direction, then yeah, the muscles will fatigue or become overused and strain over time. Or if you do it once or twice, that small amount of incoordination of the muscle activity can generate trigger points within the muscle belly that you might not immediately feel, but if we palpate and we examine. So it boils down to support points. You have to be able to create the support point, establish the support point, maintain the support point.
That's right.
And that there is a certain amount of conscious effort in that,
or
muscle activity. But the coordination that comes from the adequate support is not conscious.
It is automatic.
That's the automatic.
That's right.
And so again, it's just a flip-flop of everything. We think that the coordinated activity is the stuff that should be voluntary and we need to think about and really work when it's not. The muscle activity and the core and the attention should be placed on getting yourself in the right position.
That's right.
Propping yourself in the right position.
Are the reference points there for the brain to then use as it wishes, and not can I use these muscles as I wish or I think I should be using them, and not paying attention to the establishment of the anchors for these muscles to work. It is very fascinating that aesthesis, or the sensational awareness of the body, is so important to its efficient function, and that over time, for any reason, whether it is injury, fatigue, damage to the afferents, or so on, or bad habits, etc., or disease, that we can forget how to establish these fixed points, forget the order in which they might be required to occur, etc. And it really is something. And again, I mean, when you think about it, you can even ask yourself, when is a support point no longer a support point? When is it because a limb resting on the floor is not a supporting it's not
Right.
a supporting limb, it's just resting.
Now we're really gonna go down a rabbit hole. Just because your foot's on the ground doesn't mean
that it's a support point. No, because it must weigh more than it would weigh at rest for you to have actively established a support point.
Well, there was the qualifier.
Right.
You need to actively support versus passively support, or just
accept rest. Exactly.
Yeah, and I think that can be analogous to, if somebody asks me, is diaphragmatic breathing good, or is diaphragmatic breathing good for your posture, good for stability? I would say, well, controlled diaphragmatic breathing produces stability, but just simply using your diaphragm to breathe is nice. It has some effects, just not postural stability. That's all.
No, that's right.
If you're just simply respiring with your diaphragm and no coordination, there's no stability there.
Well, yes,
if you're just resting, that's
the
what
baby starts breathing, but he can't move. So respiration alone is no guarantee of stabilization.
Right. If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook @IMTR Seminars.